Hello, good morning, and good evening. It depends what time is it now in your country. As we know, we have a speaker and audience from different countries for this webinar. This is Abeer Alghofaili from Saudi Arabia. I'm an optometry specialist at King Khalid Eye Specialist Hospital. I have a master's degree in investigative ophthalmology and vision research from Glasgow Caledonian University. Actually, it's given me a great pleasure to have a talk in this valuable webinar. My topic for today, contact lens for keratoconus patients. What are my options? So I'm going to be discussing the type of specialty contact lens that can be utilized for keratoconus patient. Corneal topography. Corneal topography, it's very beneficial in both the diagnosis and management of patient. There are 3 stages for keratoconus disease. Early keratoconus, when we are looking at the pentacam and found that K reading at 40s. And the second stage is moderate keratoconus, when K reading at 50s, and the last stage, which is advanced keratoconus, and the K reading at the last stages and K reading at 60s and above. The design to be selected for keratoconus patients depend in a large part on such factors. And such factors as how much it has progressed, the size and location of the apex, and the patient's past experience with a contact lens wear. However, frequently in the clinic, I get asked what's the best lens for keratoconus. Well, the best lens is the one that maintains the corneal health while providing a good comfort and good vision. And for each individual, that's going to be different type of lens. There's no such a thing as a one-size-fits-all the keratoconus patients. Experienced and skilled practitioners will customize a design based on patient's severity and visual need to create the best lens. Specialty contact lens come in variety of different shapes and material, and there are 6 main modalities that are used in keratoconus patients, and that is soft contact lenses, gas-permeable lenses, piggyback lenses, hybrid lenses, scleral lenses, and scleral prosthetic device. And all the lenses have pros and cons. We will go into those right now. Keratoconic soft lenses are one of the modalities, and they are made of soft lenses materials. Nowadays, lenses differ greatly from the mass manufacturer's standard soft lenses that many of us are familiar with. These lenses are about 5 times as thick, and that's what gives us pseudo-rigidity to the lenses to mask the irregularities of the corneal shape. So patient with early or mild keratoconus, especially one who's refractable, I offer the keratoconic soft lenses as a first choice. These lenses are highly customizable, and bending the severity of the disease can give a great outcome for individuals. The pros of these lenses are they have a simple handling and care and have a good comfort, but the cons are they are usually a little bit of vision to comfort compromise. Some individuals find that they are willing to give up a little bit of vision to the comfort that they may get with this care of keratoconic soft lenses. For years, practitioners have known that the thicker soft lenses have the ability to mask some corneal stigmatism and may work for patients with a low corneal stigmatism. They rarely were successful for any patient have a manifested significant amount of astigmatism, irregular stigmatism, or keratoconus. To manage the keratoconus, practitioners have tried using a toric soft lenses, but accepting patients in the early stage of disease. The results generally have been poor. Actually, the mainstay of keratoconus management has been through the use of rich gas permeable lenses, which provide outstanding vision. But keratoconic patients consistently reveal that discomfort with the GP lenses is a significant determinant to a quality of life. Lens is made from silicon hydrogen material that is a design for quarterly replacement. A trial set come with 8 lenses with the standard 14.5 millimeters diameter and other available, and have a plano power and a range of base curve from 7.8 to 8.6 with other availables. Most lenses in the set have a standard periphery, but the flatter base curve also include lenses with a flat and steep peripheries for unusual fitting circumstances. It's a lean set, but one that is very useful in its intelligent design. Powers are available from plus 20 diopters to minus 20 diopters, with a cylinder from half to 12, and in a quarter increment at any axis. For the fitting assessment of keratoconic soft lenses, we must evaluate 5 steps as follow. The first one, we have to see the movement, is evaluate the movement, and evaluated, and up to 2 millimeters of movement is acceptable as long as a patient is comfortable. Change the base curve radius if a movement is greater than 2 millimeters or less than 1 millimeters, or if the patient is uncomfortable. Actually, in this situation, we prepare to see more movement with the soft keratoconic lenses than you would otherwise observe with conventional soft lenses. Increase the patient comfort. Patient comfort comes with adaptation. So patient education is very important here. Rotation is assessed using the vertical laser mark, which should be at 6 o'clock, stable with up to 10 degree of acceptable rotation. Rotation will need to be compensated. A slightly flatter base curve may improve the stability, but unstable rotation is caused by a flat fit. A stable but greater than 10 degree rotation implies at a tight fit, and the base curve should then be flatter. Centration should be good, but a minimal amount of decentration is acceptable if the visual acuity is stable and clear. If the vision improves immediately after the blink, then there is a tight fit. Lateral decentration with a drop on upgaze indicate a flat fit. The last and the fourth situation we have to evaluate is comfort should be good, but if a presence edges awareness exists, try a steeper base curve. If there's a discomfort and the lens is stationary, the lens is likely tight. And the last assessment we have to see is visual acuity. Visual acuity should be stable without fluctuation between the blinks. If the vision is worse after the blink, it's likely due to the flat fit. If it's clearer after the blink, a steep fit is likely. If acuity cannot be achieved after the above adjustment, so here we need to seek another options of contact lens. The second option, or the second modality, is the gas permeable lens. Gas permeable lens, historically regarded as a standard of care for individual with keratoconus, rich lens material, and this is what makes the irregularities in a corneal shape, so that we can get a crisp, clear distortion of distortion-free vision. These lenses are highly customizable. Trial of gas permeable lenses usually come in variable base curve, starting from flattest lens, which is 7.6, until the steepest lens, which is 5.1. but we have extended range in the clinic that reach up to 4.4, which is the steepest lens available in hard contacts. Choosing the diameter depends on three factors. The first one is the most important factors and the progress of the cone. Choosing the large diameter for early cases, medium diameter for moderate cases, and choose a small diameter for advanced cases. The second factor is the size of patient's eye and the eyelid. Large the palpebral features, the large lens we need, and the smaller the palpebral features, the smaller lens we need. And the last factor, the location and the size of the cone. The smaller and the central cone is the smaller lens we choose, and the larger and the decentral cone is the larger lens we choose. So here we have examples for the shape of the cone and the best diameter we can choose. The figure A, it looked a small central cone, nipple cone. The cone is very small and centered, as you see in the figure A. So we can manage this case by a small diameter. And the second figure, which is figure B, it looked like a mite-sized, like an oval cone, which is the most common case. The cone is a moderate in size and located slightly down, as you see here. Slightly down, so we will choose in this case a medium diameter. Figure F, it looked like a globic cone. The cone is very large and covers almost all the cornea, so we will choose in this case a large diameter. Okay, and most GP lenses, it comes in three diameters: large diameter 9, and medium diameter 8.7, and small diameter is 8.3. The pros to these lenses are that they are simple lenses to handle and take care. They provide a good vision and have a good durability when cared for properly. These lenses should. The downside to these lenses is that initially the lenses may not be very comfortable, and in severe cases of keratoconus, the lens may be unstable on the eye, such as the lower wrist photo that you see with the lens about to be blinked off of the eye. Many of keratoconus watching this may relate to the situation. That lenses in that cases is not actually the ideal lens. For that individual, we need to move on to other modalities, and gas permeable lenses are kind of the mainstay. We are going to be comparing the other modalities to back to the gas permeable lens. Now, piggyback lens system are the use of standard soft lenses with a rich gas permeable lens resting over the top. It's a two lens system. The pros of this compared to gas permeable lens alone, that is going to provide improved initial comfort because of the soft lens underneath the gas permeable lens. As you can see in the permeable lens act as a cushion to the hard line. Now we can have a little fun with these lenses. As you can see in the bottom right photo, we have used a prosthetic painted iris lens to be able to improve the eyes. So I don't know if you can see the photos in the right. Yes, okay, perfect. So in this photo and the bottom right photo, we have used a prosthetic painted iris lens to be able to improve the eye cosmetic appearance due to scarring from keratoconus, and also to be able to improve the visual outcome by providing an artificial pupil size, so that is an experience less glare and halos and other visual disturbance. The downside to these lenses is that there is a perceived difficulty in handling the lenses and caring for the lenses because there are two lenses Patient, when I bring this up, typically say, "Oh no, now I have to take care of two lenses." Well, usually it's actually not that cumbersome in most cases. We can use the same hydrogen peroxide-based cleaning system for both the hard and soft lenses. In some cases, the soft lenses below the hard lens can be daily disposable lens, which require no care at all. And actually, we recommend this type of lens for all the patients using a piggyback lenses. The other issue with these lenses that can happen is that just like our gas permeable lenses, when the disease get extremely severe, the stability of the lens become indicate, and we may have problems with the blinking. This lens of the eye and distributing the visual system. So another modality are hybrid lenses, are a combination of hard soft material. They have a rich gas permeable lens, permeable center with the soft material scared on the edge of the lens. And what this does is it provide a vision of gas permeable lens while providing the comfort and stability of the soft lens. The pros of this are that we really have a better consistent and improved vision and comfort because of the stability as compared to gas permeable lens. The downside to these lenses is that the lenses, because they do a fall to the cornea, meaning that there's a space between the back of the lens and the front of the cornea. These lenses need to be filled with a sterile non-permeable saline solution. And when we place this on the eye, we need to make sure that we don't spill any of that saline out of the lens, because it's need to maintain the small or rather occupancy, that small space between the back of the lens and the front of the cornea. Otherwise, we get bubbles, and those bubbles distribute the vision and cause complications and irritation to the eye. So there's a little more complexity in handling of these lenses as compared to gas permeable lens. Now, clear contact lenses are a large diameter gas permeable lenses. These lenses can range anywhere from 14 millimeters all the way up to 24 millimeters in diameter. These lenses are fully vault at the cornea surface, making the entire weight of the lens rest on the white of the eye or the sclera, which is where the lenses get their name. These lenses are highly customizable, and these lenses can improve the comfort and lens stability as compared to other modality of contact lenses for keratoconus. This can be a great option when all the lenses has failed. So the very, very advanced cases, the extreme severe cases, this can be utilized effectively. The lens also has therapeutic indication for individuals with a severe ocular surface disease or severe dry eye. And it can be used to help heal the ocular surface because of that liquid reservoir, or rather than non-permeable saline that is present underneath the lens. Now again, just like the hybrid lenses, the lenses have increased complexity. When it comes to handling, when we put the lens on, we need to maintain the fluid in the back of the lens, otherwise we will get bubbles underneath the lens, which will cause a problem with the vision as well as a comfort. And when we do the fitting for this type of lenses and we have a bubble, so we need to remove the lens again, and we need to remove the lens and insert it again. The last modality that we will discuss, our synchronic prosthetic device. This device are similar to sclera lenses, another large diameter gas permeable materials. It's made to fully vault the cornea surface. These lenses are manufactured differently. However, in the process of impression, molding, 3D rendering, and then wave cutting, this device are able to overcome the most complex geometry in the most extreme cases. The pros of these lenses are that you get an exact fit and success when all other options have failed. They're able to incorporate highly customized optic into the lenses because of their stability, and in some cases you are able to have a faster fitting time. The downside of these lenses is that, like hybrid lenses and traditional scleral lenses, these lenses must be filled with a sterile non-receiver saline, which can increase the complexity in the lens handling. However, with the time, it must be noted that it will become second natural to aware of this type of lenses, whether it's hybrid, squared, or square prosthetic device.